of, maybe you don't. So it will be a revision for everyone to, to just go through, because this speaking criteria is really important. Okay, all right. So what I'll do, I will share a screen. And before that, I start with speaking assessment criteria. I just want to know that how many of you have a bit idea about speaking assessment criteria, that what it is, and why it is so important to know about assessment criteria. Anyone? Yes,
Um,
you guys can share your thoughts. Okay, yes, anyone? Come on, you guys can tell me that um, what you feel about
something like that.
and that's so important. I didn't hear you properly. Your voice is breaking. Okay, so first let me know that how many of you are there. Chinu, Kulvinder, Lissy. Lissy, Savita is also there?
Yes, ma'am.
Okay, so good to know about you, Savita, that you have also joined. So Anjali, Biju, Binu may not be able to, but yes, I'm giving Nibha also. I'm going to give a missed call so that you guys I would suggest if you guys can join, it's okay, because this assessment
Hello?
criteria
Hello?
would be a
Ma'am, the voice is
revision
not
for
clear, ma'am.
everyone. So
Yes, OET.
okay, so is it clear now? Is it clear
Yeah.
now?
Yeah,
Yes,
ma'am. Now it's clear.
Okay, so can you see the screen as well? Yes, the screen is visible to you guys.
we need to clear.
Okay, so Lissy, can you see the screen?
It's visible, ma'am.
Okay, all right. It's visible, then it's good. Okay. So this is the
Ma'am, your
assessment
voice is
criteria. Speaking assessment criteria, as I informed you guys earlier also. So yes.
yes,
Okay, so
ma'am.
is it better now?
Yes, we can.
Okay. All right. So this speaking test is for 15 to 20 minutes. The test will start like you will, you'll enter in the room. They will take you to the room and they will tell you that your session is going to start now. And when you will enter in the room, it is good to greet your examiner. You can say good morning, whatever is as per the timing, good afternoon, good evening, like that. The moment you'll enter in, the examiner will also say you, I mean, not examiner, the interrogator, he will also say you good morning, good afternoon, as per that. So he will say that my name, first he will give introduction that my name is so and so, and I will be your interrogator for today. So then you can also give your if they ask. If that person asks, it could be he, it could be she. Okay, so depending on the gender, you need to communicate during the task he or she, whatever. Okay, so the first round, the moment, it is not that you will enter, sit, and they will start. No, he will try to make you comfortable, or she. And then they will ask you, first round is a warm-up question. So mainly the warm-up questions they ask are very, very common and basic. For example, they will start with, you can tell me about yourself or your introduction. No need to give a big introduction, only just my name is Kulvinder Kaur. I have done my, if you want to say I'm, 30 years old, I've done my graduation from this and this college, and I have a total 10 years of experience, and presently I'm working in XYZ hospital. Clear? This much information is enough. If you want to add, you can add on. I'm married, I have a family, I have 2 kids, blah, 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 that you can. But don't stretch it more than 3 or 4 lines. Okay? Is that clear? Okay. So the second point is further, is like second thing after that he will ask you, okay, so why you have chosen this nursing profession? So you can give your appropriate answer. So whatever I'm saying, I want you guys to note down, and I need to see your answers in the group by today evening. Okay, so make sure you write all these things, what you're gonna say, and send to me today evening. So you can say that, okay, so I have joined this profession. Now don't say as since my childhood I had a passion of this. Make something logical because everybody says the same thing. So you can add on. I'm not going to tell. I want your ideas that what you will say. Okay, and third question, why you want to go abroad? Why you have chosen OET? Please note down all these questions and share any bad experience or worse experience that you have, and how did you handle that situation. Let's say how did you handle a patient who complained about you? No. And another question they can ask you is, what a message you would like to give to a newcomer nurse in your department. Okay, and one more is like, yes, you can also say that, um, probably about the technology, that any new technology advancement in your profession that you have noticed, any recent changes. So you can talk about anything as simple as even a mercury thermometer to a digital thermometer to automatic machines to a cardiac monitor, you to even barcoding, BRSA, the medication delivery system, and even now no documentation, everything is on a system. It's up to you. You can say anything, but you need to make sure your lines should not be more than 4 lines. Only 4 lines for each questions. For each question. All right. And I want all these answers in the group by today evening. Is that clear to everyone?
Yes.
Ma.
Okay, great. So please write your answers. I will tell you that what is the best way, but if I will tell you now, probably you will not be able to get your own idea. So I want you guys to write in your own way. Now, this all would be, now these all are the possible questions. They are not going to ask you so many questions. No, they will never. They'll ask you maximum three and minimum even one. They can just ask you that, okay, so tell me your name. So my name is this. When they ask you, tell me your name, then only tell name. Don't tell I have done nursing, I've done so and so. No. If they're asking you a open-ended question like tell me about yourself, then you can say. If they're asking tell me your name, then just say my name is this. Okay, so what do you do? I'm a nurse by profession. Okay, so where do you work? I work in this hospital as a so and so. That's it. Sometimes they ask very basic thing, and this in this round they are not going to give you any mark because this is just to make you comfortable. Okay, so then they will ask you that are you ready, can we start the cue card, can we start the exam? So yes, and then they will. Now some examiners start the put the recording button when you start cue cards, and somebody, they start in starting also. The moment you'll enter in, they will give their introduction. At that moment they will press the recording button on. Okay, so make sure whatever you say, speak clear and speak slow so that your voice get recorded well. Okay, and always hear your recording after the test. They will also start to show you that it is recorded, but in case if they don't, then you can ask that, can I please check if my recording is done? Okay, because sometimes it happens. One of my students, she went back again to give her the speaking because it was not recorded. Okay, all right. Now that's why I say that when you say this line in your task that um, please have a seat, that doesn't make sense because you both are sitting since almost now 5-10 minutes. 5 minutes might be over during this time. Now 5 minutes is over in the first round, and second round they will give you a cue card, and this cue card will give you 2 to 3 minutes for the preparation. Okay, and the moment you get your cue card in hand, start reading. Don't look at the examiner that he will say you to start, because he will have a lot of things to do. He will keep on saying, recording his own work, like I have this candidate number, this, my this today, this date. This is his work, let him do, but your focus should be on your card. You will get some extra time probably. Okay, so without wasting anything, the moment he handed over you the card, start reading it. That will give you some extra time to read and understand the task. And after 3 minutes, he'll tell you that, can we start? The moment he says start, you must start. Take some time, few seconds, and then start, because his recording button, his watch is on. Okay, so you'll get 5 minutes to speak and make sure you complete your task. So once that 5 minutes over, you'll get second cue card. Again, you'll get 2 to 3 minutes for preparation. Again, 5 minutes to speak, and then end. So total 10-12 minutes, maximum 15 minutes exam only. Okay, so that's what I say. It's just a matter of 10-15 minutes. So perform your best, give your best. Okay, now moving to the point that how do they assess your score, how do they give you scorings in this speaking? Now that person, again I say, like it's not like IELTS that he will check your confidence level, he will check your body, that how you look, how you appear. It all doesn't matter at all. Your voice will be recorded, only voice. It's an audio recording, not a video recording. And then it will go to Australia. They will give you marking based on the recording. Now, based on the recording, and second thing, they have the checklist with them. Now, what is that checklist? For example, you guys have a crash cart and there is a checklist. So you check on daily on your duty that all these items are present in the available in the crash cart, and then you do a sign, right? Same way they have a checklist of this criteria. They will look for this items, particular sentences that have you used this in your speaking, and then they will give you marks. You might have heard some people get 330, 340. 330, 340 is completely because of lack of confidence, or just because of the silly things. So make sure you sound confident, you do well. So there is a two type of criteria. One is linguistic, another is clinical. The clinical, they can judge you based on the checklist. Linguistic, they are gonna observe you. I mean, they're gonna observe in your speaking that have you used, how do you sound, how do you pronounce the word, what kind of vocabulary you use, your English is good, are you sound like a regular speaker, or you have just mugged up some lines. So never follow any fixed lines. For example, please have a say it. Once again, I would reassure you, no, don't fix any line. Make sure your starting and your end should not match same exactly as your second task, because that will give an idea to the examiner that you have done something by heart. To look a natural speaker, you should sound confident and you should use some good phrases. That's what we are going to discuss today in the session, that what all is that. Now, first is the linguistic criteria. Okay, so now this one is the linguistic criteria. Now, linguistic criteria, if you can see on the screen, it has main 4 points, and all these 4 points have six marks, six band in sense. So it's really important to work on this thing. You should know that, am I using all this thing now? Most of you have done, like Lissy, Savita, I think everybody has done the topics. So now you check and tell me yourself that do you use this kind of the things in your your task. Now, first is intelligibility. Intelligibility doesn't mean that you should sound intelligent. No, it means how do you how is your intonation, tone. I always say, no, work on the tone. It should be appropriately. If you're sounding like, oh, I'm sorry to know that you had to, it looks very, it looks professional, but it's not touching my heart. If I'm in a pain and you say, oh, I'm so sorry to know that, no, that is touching my heart. It sounds, that is intonation. Okay, stress. Where do you put a stress? For example, oh, I'm so sorry, so sorry. Now, some people say sorry. So stress is the main word. So put a stress on that. I'm so sorry to know that. That's a stress. Rhythm. How is your rhythm? Is it a flat, or it should be like a ECG wave? Up and down should be there. For example, oh, I'm so sorry to know that. Pronunciation. How do you pronounce the word? That's very, very important. So all these things will give you 6 marks. Yeah. Okay. Second is fluency. How fluent you are in speaking. Now, some of the people, the students, they misunderstood. Now, fluency doesn't mean if somebody speaks fast, that means he has a good fluency. No. Ideally, your English is spoken very slow. And moreover, in your task, you are educating somebody, you are advising somebody, you are motivating, you are encouraging. So that means you should speak slow. As I always say, your fluency, your speech should be like you are explaining something to your grandmom, because you will speak slow to teach your grandmom. right? And adequate pauses. I always say give a pause after every task. Remember, this are 6 points. It is so important. Now focus on the pauses while speaking. It has 6 marks. Okay, the short pauses means comma, and the long pauses is full stop. You know, in a writing, we can put a comma and full stop, but in speaking, how a person will know that you have finished one sentence? You should give a pause. For example, you advise the first thing, I would recommend you to join a quit line program. Now stop for a while. Give a pause here. It's a full stop. Give us a long pause. Long pause means for some second, for 30 seconds. Then you can say, then ask, I hope you understood that. Or you can ask when you're advising like such a thing that join quit line program or group, you can say, can you do that? Now, can you do that is another thing and give a pause. That means pause means here the pause means you're giving a time to the patient or relative to understand what you are saying. So these are 6 marks, remember. Such a small thing, stopping. You have to stop while speaking, and that will give you 6 marks, but it should be appropriately adequate. Inadequate means if you're giving long pauses. Now that indicates that you don't remember the things, you don't know what to say next. You're forgetting the things. You're not fluent. Okay? So that's another thing. Now, third is appropriateness of language. How appropriate is your language? I always say tone, laxes, tone is very important. The person is in a pain, and the person is saying, I want to die. I don't want to take the treatment, chemotherapy. And you are saying, no, you have to take it. Now, that sounds quite true. So what is your tone? If a patient is in a pain, your tone should be in the same way, like it is you're empathizing with them, right? And explained in lay language. I always say this during the session. If you will explain the more you will explain easy, the better score you will get. 350, it's not hard to get, and it is also not hard to increase the scores to reach 400 plus. It's only if you will explain in an easy language, you will score more. Last is resources of grammar and expression, how your vocabulary, how good you are with your sentences. Are you using a variety of sentences? You're using compound, complex, or simple, and how how confident you are. That will give you another 6 marks. So all these are silent features that they're gonna observe, they are gonna find out in your speaking. You're not gonna say all these things. It should reflect automatically. Is that clear?
Yes.
Okay. Now, the next is the clinical communication. Now, clinical communication. Now, this is the second criteria, which is very important, and this should be on your tips because based on this, you are gonna speak in your task. Now, first one is relationship building. Very important. When you meet somebody who is the patient is unknown, is not your relative, right? Unknown to you. You are meeting somebody first time. Now you must start okay. Now this is very important. The moment the examiner will say you interrogated that start your exam, don't expect that person will say first good morning and that my name is so and so. No, you will always start. Don't wait for him or her to start first. You will always start with good morning. You will greet the patient, then you will give your introduction, and then we'll ask the name. So that's how you will start the conversation. Second, be attentive. Be attentive. That means you will be alert, attentive. Now, alert, I can see that by your physical features, your eyes are open, you're making an eye contact, your body is perfect, sitting posture, everything is perfect, that shows you are active. But I'm not going to see your video. I'm going to see your speaking, your voice. So how can I find out that you are attentive to the patient? Can anybody tell me?
Giving response.
Yeah, thank you so much. Yeah, giving response, for example, okay, all right, I understand, yes. Now, these are the words that you will use when the patient speak. Now, you will not interfere in between. Whenever he finish one line, for example, you say, oh, I'm a chronic smoker for last 10 years. I take almost a packet of cigarette in a day. Now he has completed his sentence. You can say, okay. All right. So don't just jump in between to get, no, I'll get marks for this. And he say, I'm a smoker. You in between, you say, okay, okay, okay. No, that's wrong. Okay. So make sure you are saying these words on an appropriate time. All right. Non-judgmental. Nurses always have to be non-judgmental. Why? Because you don't know what is the on other side. I think it is not only for the nurses on a nat on a for every human being, for every successful mantra of all the relations, either a daughter to father or to anybody. You have to be non-judgmental for others. Why? Because you don't know what is the story on the other side. You must listen that first. So that's why we always say the nurses should be a good listener. So non-judgmental, when you are saying the patient that you need to go for this blood test, and the patient said, no, I don't want to undergo this test. And you're saying, no, then recently we have done the task in which you were saying the patient to go and take a bath, take a shower, and patient said, no, I don't want to take the shower. I'm okay, I'm resting here. And you'll say, no, you must take because now your surgery is over, you're perfectly fine, you must go and take the bath. Now, that is wrong. That means you're getting judgmental. Non-judgmental means you will, when the patient refuse for anything XYZ, a sample or medicine or anything, like even taking a bath or shower. You can say, okay, I understand your concern, John, that you don't want to take a shower. But may I know what is the reason why you don't want to take it? Now that should be the appropriate answer to a non-judgmental approach. Show empathy. Let's say he said, I have a dressing on my shoulder. It will get wet, so I don't want to take. Now that is good thing, he said. Oh, I understand your concern. Okay, don't worry about it. I'll put this tape, plastic tape, which is waterproof. It will not get wet and the problem will be resolved. Is it fine? Okay. But show empathy. Oh, I understand your concern. Well, I must appreciate that you're worried for your wound. Okay, now that is what is empathization. Now, this whole relationship building, the whole process under this is gonna give you 3 score. Very important. This is a checklist will the examiner have. He will see you were attentive. Did you use the words like yes, no, okay, all right? You were non-judgmental. Did you show empathy? So all this point will give you 3 marks. So it is that important. So now make sure when you do your practice, are you using all these lines? Then give yourself mark. Okay. Second is understanding and incorporating the patient's perspective. Okay, before I go to this, I just want to know that I hope relationship building is clear to everyone.
Yes, ma'am.
Any questions from this? Now be ready because next I'm going to give you some queries. I will ask you to share examples, which you have to because we have done a lot of tasks. Okay, so moving further, the second is understanding and incorporating the patient's perspective. Means you need to understand, and incorporate means include the things from the patient's perspective. For example, he said that my wound get, then you are saying, okay, don't worry, I'll put the plastic waterproof tape, won't get wet, right? So like that, you have to be very, from the patient point of view, you need to understand and help. So include exploring the patient. So you need to explore. Whenever the patient said no for something, ask the reason. What is bothering you? And then he said this concern, and then tell, okay, I'm gonna put this tape and give the examples uh, related to his problems. Let's say he said, I don't want to take this medicine because one of my friend was taking, and his liver got damaged. Then you can tell, well, I understand your concern, John, and I'm sorry to know about your friend, but let me tell you that every medicine has a different reaction on people. And maybe in your friend case would be different. He might have taken this medicine for a long time, and but in your case, this medicine is completely safe, and it's not gonna give you any harm, and moreover, you're going to take this medicine only for next 5 days. Give examples accordingly. Third is providing structure. How do you move further? Like we say, okay, before moving further, it's like you have to go purposefully and logically and ask technically and go as per like we move in the interview, because two-person are sitting. Sometimes if you're not feeling this now, always listen to the listening part A of OET listening part A. It is same as you are going to do your speaking. Learn some points, pick up some points of the doctor from part A, that how she's starting, how she's empathizing, how beautifully she used the phrases. She take a permission for each and everything. So you're doing so many listenings in a day, and you can collect so many words from that. All right. So get some
Yes.
words from the listenings when you do that. Write down that phrases and learn how, and you can use them so beautifully. Okay, now one of the important thing they have written here, make clear changes in topic. So just to say this line, when I always say you talk in a points, right? And tell that I'm going to talk about this. For example, you're gonna advise about lifestyle. We have recently done so many tasks on lifestyle. So you can say, firstly, I would like to, I would talk about the importance of diet. Now, this particular line, I will talk about this, will give you 3 marks. Just one line, and will give you 3 marks. That means it will give a clear picture to the examiner that you are making a clear changes in the topic. When you're saying, okay, so now moving further, I would like to ask you some questions about your symptoms or about your condition. Is that okay? Now you're telling him very clearly to the patient that I'm going to ask you some questions. Okay, so that's very important. Always do that. Always, when you are moving from questions to the repeating, verifying, and then verifying to giving answers, everywhere you have to tell the patient clearly that I'm gonna do this, and this. Okay. Now, fourth is information gathering. Now, these 2 points, listen it carefully because these are really, really important. Your score, the more score you will get from these 2 topics. Information gathering, how you have to gather the information. Now, never ask closed-ended question, always open-ended. So, Chinu, are you there?
Yes, ma'am.
Okay. So, Chinu or Chinchu? Chinu.
Chinnu.
Yeah, sorry, I always get confused. So, can you give me an example of a closed-ended question or open-ended question?
Uh, Open-ended. What brought you here today?
Mm-hmm.
Then closed-end. Do you drink alcohol?
Sorry, say again.
Do you drink alcohol?
Do you drink alcohol? Okay. Yeah, that is closed-ended. When the answer is in one word, like yes or no, then it is closed-ended, open-ended. Now, what brings you here is not, that's also fine, but usually we avoid asking. And we can start as what is given in the task, like that. For example, patient has accident, he's moving with limping, and then you go, oh, what happened to you? You're not walking properly.
Okay.
Okay, and we can ask this also. If nothing is mentioned, you can ask what brings you here. Okay. All right. So Lissy, any example?
Yes. Last 10 question. Do you smoke?
Mm-hmm. Yeah, perfect. Like closed. Do you smoke? I'll say yes or no. But if you'll ask, what about your smoking habits? Then he can answer everything about the smoking. So always important, remember this is one of the criteria. You'll get marks for this. So first question should always be open-ended. However, related question could be closed-ended. For example, he did not say how many cigarettes he take. Then you can ask after that, how many cigarettes you take in a day. Now, second thing which you need to remember, never combine two questions together. For example, what about your smoking and drinking habits? No. Ask separately or ask a single question, what about your social habits? Minimize interruption. Never ever interrupt the patient in between. I've noticed this many times during the exam also, that some of the students say, I think this problem is mainly with the very senior person, those who are on the supervisor level also, because they always advise, they don't like to that somebody stop them in between. And I have also noticed some of the students say that, oh, I explained to you just now. Never say that, and never interrupt the patient. If he's asking something again, you need to answer again. And if he's saying something, you must stop and listen to the patient. Let's say you are talking and in between patient is asking you something, you must immediately stop and say, sorry, can you come again? That shows you are attentively listening to the patient. So sometimes the examiner can do that purposefully also if it is written in his task. So if you are advising something and patient talked in between, then immediately stop and say, sorry, I didn't get, can you say again? Okay, that shows you are giving more importance to the patient. All right. Now, if patient has any doubts, it's not clear to him, then always clarify the statements to him. And then summarize all the information. Now, summarize information and any further information. This is a very, very important step, and I want all of you, those who are not using this step, please use, because now this summarizing means not summarize the advice. No, summarize the questions, answers, whatever the question you asked to the patient. For example, you asked any past medical history, any allergy, any smoking, drinking habit and all. And then you need to repeat all that information like, okay, Tina, so from your words, I understood that you are a smoker for last 10 years. You take 2 cigarettes in a day and you take a couple of drinks in the evening after work, and you don't have time for exercise and you live a sedentary lifestyle. Is that right? So yes. Now, let's say maybe you miss something, or then patient will say, no, it is like that, not 10 years, 20 years. Okay, all right, thanks for the correction. Now, this is a very, very important step. Remember, this is not only going to help you in OET, this clinical communication criteria is going to help you in your OSCE also, which you're going to give in UK when you reach there. Okay, so listen to this clearly and understand. It's going to help you later also. So remember, this is a very, very important step, which I want you guys to remember during your task. Now, this is the way to gather the information, ask the question, then repeat everything to the patient, and then confirm. Is it correct? Let's say yes. Okay. Thank you so much for sharing the information. Say that. And then is information giving, the last one. Information giving. I hope this gathering is clear to everybody. Any doubts for anything? If you have questions regarding um, the lifestyle, you can ask directly. What about could you mind explaining me about your lifestyle, your daily habits, or how is your daily routine? I think that's also a good way to ask instead of asking, what do you do for to living up? I think that's not a good question just in your work. Um, or if it is written in that way, you can ask that, would you mind telling me about your personal and professional life? Okay, so these are the various ways to ask questions, open-ended questions, and then it will really gonna help you. Okay, the last is information giving. Again, actually, this one is not tough because whatever you have to say, it is already given. But how you have to say it's technically, where you have to stop, what you need to ask is very, very important. This gonna give you a lot of marks. Now, information giving. While giving the information, once you ask the question, you thank the patient. Thank you so much for sharing the information with me. After that, always relate it with the okay. Well, as per your your symptoms are, as you're smoking, and probably that's a reason. One of that could be. Now, never say that that is one of the reason. Okay, that could be one of the, might be, could be, probably, possibly. Use these words. There is a possibility that you have, as you have been recently diagnosed with high blood pressure, so your smoking and drinking habit could be one of the contributing factor. Now, contributing factor, it's a very good vocabulary word to use. It could be one of the contributing factor to your current condition. One of the, not only the contributor. Yes. Yes, guys, you asked me something? Hello?
No, ma'am.
No, ma'am.
Okay, all right. Okay, all right, you can ask me. So this information giving is, always establish what the patient already knows. Now, this is a very good step. Now, I think some of you sometimes use, but this is the thing you have to use even though it is not written in your task. Sometime it is written in the task, like we recently did that, check the patient if she has a knowledge about IBS and explain in easy word. Most of the time it is not written, not mentioned, but you have to do. So before you explain or advise anything to the patient, ask the question. Now, I think the recent one was the one we did about the seizure. The patient had a seizures in the office. Some of you asked, do you have an idea about seizure? I think her main topic was not about seizure. Her main thing was she was worried how to, it will be the diagnosis, and what you are going to advise, that is what you are going to talk. In your advice, it was not written about the explanation of seizure or epilepsy. It was written the explanation of the diagnostic, like EEG, and the treatment. So you're gonna ask that, do you have an idea about that, how we are gonna treat it, or how we are gonna diagnose it, how we are going to confirm it? No, okay. So don't worry, I'll explain you. Now, same here. She doesn't know about healthy lifestyles. You can say, okay, well, what I'm going to do. So, as you said, you have a little bit idea. Let's say the patient said, I know this. If I will reduce my smoking and drinking, I will be healthy, but I can't. You can say, well, I really appreciate about your knowledge, but let me just highlight the important points. Highlight. means you're just going to add, or you're saying, I'm going to add more information to that. Highlight is another vocabulary word. I hope you guys are noting down it.
Yes, ma'am.
Okay, so that's what you can say that, all right, so let me just highlight it more about it. That will help you. Is that okay? Then again, take a permission, say yes, okay. So after that, when you said your first point, that firstly, I will talk about what is IBS, irritable bowel syndrome. You need to understand it is this, explain that. Now you highlighted the patient that what you are going to talk about. Secondly, I'm going to talk about its causes. That there are various XYZ causes of it, and the stress could be one of the main important factor. As you said, you have recently changed your job. Now, finally, I will give a recommendation and will give you some advice which you can easily follow at home. Um, as I mentioned, the stress is one of the main things. So there are some changes which you have to do in your lifestyle. It depends on your food. So I would strongly suggest you to take a food where don't take a high fiber food, because that will increase the symptoms. And moreover, to reduce the stress, I would suggest you to join some yoga clubs and do a meditation or just a general walk for 40 minutes. That's gonna help you and will keep you stress free. Then give a stop here. Now, I gave here 3 advices. You will always remember there will be always 3 advices. So say firstly, secondly, and finally. So when you say firstly, for your first advice, highlight that I'm going to talk about this, and then advise, and then stop for some seconds. And then ask the patient, I hope it is clear to you. Again, stop for some time. We'll say yes. Wait for say him to yes or no. We'll say yes. Okay. Secondly, I will talk about this. Advise, then again stop. Now, don't say the same word here. I hope you understand. Say something. Do you understand that? Say yes. Okay. So finally, this, and then advise, again pause, and then say, how does that sound to you? So, for example, now, how does that sound to you? We always use this phrase when you are giving some idea, good idea to the patient. For example, you're saying for the stress, I would recommend you to join some, yoga clubs or do a meditation and just take out a 40 minutes of schedule from your daily routine and go for a morning walk. Huh? How does it sound? Or can you do that? Yes. Wait for yes or no. Okay. But these pauses, it is written the 5th, second point, pauses while giving information. Very, very important, because that shows that you are giving the time to the patient to understand whatever you advised. Now, next, encourage to share thoughts. When you are saying, do you understand? That means you are encouraging the patient to share the thoughts if he has anything in mind, any questions. And once you all the 3 things done, and at the end you can say, well, no need to say this fixed line. I hope I have cleared everything to you. I think these lines are fixed. Now come out of these fixed lines and be very natural and say, okay, so do you use these words? Well, okay. Now these words shows that you are a natural speaker. So let's say finally I would talk you to join the stress and yoga free. Is that okay? Let's say yes. Okay. So do you have any further questions for me? So no. Okay, so this is the leaflet for more information about your situation, and that's gonna help you. And in case if you have any questions, you can press the buzzer, or if it is an IPD case, then press the buzzer. If it is OPD case, give a leaflet and say that you can come anytime. And I always say that wish you a speedy recovery. Wish the patient a good recovery. Now this is what, now this checklist will be with the patient, will be with the examiner. when they're going to listen your recording, they will have this checklist in front of them, and they will tick on this, that have you used this, have you used this sentence, or not, no, 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 yes, 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 and accordingly your scores will be calculated. I hope it is clear to everyone.
Yes, ma'am.
Yeah. Now think, see, this even giving a pause is such a small thing to give a pause, but it's gonna give you a 6 band, 6 score, which is very important. Okay, so giving a pause at appropriate time is very, very important. Remember, clarifying it in an easier way, summarizing the information. So if I make it in a flow chart, how do we start actually? We start like with the greeting and then introduction. I'll just do it like we'll say, good morning, my name is Jocelyn. I'm the nurse in this department. How can I address you? Say, my name is this. Oh, Tina, how are you doing? Say, I'm okay. Well, let's say the patient is admitted. Yeah, it's good to ask the patient in the morning that, how was your night? Say, that's good. Good. All right. I hope you had your breakfast. I'll say, yes. Well, that's great. Well, I can sense that you're looking a little upset. So what is bothering you? Now, this is the perfect way to start introduction with the um, uh, inpatient setting, right? And then after this, you can say, okay, I'll say that, yes, I'm worried about this. Empathizing is the next step. I hope you're writing down the steps. Yeah, so the moment he said, okay, so you asked that what is bothering you? He told his problem that I have a pain. Then your immediate reaction should be, oh, I'm so sorry to hear about that. You didn't sleep last night well because of the pain. Oh, so just let me go through your case notes and oh, you didn't take your medicine. What happened? I noticed that it's written refuse, so may I know the reason? See, yes, this and this reason. Okay, well, I understand that you don't want to take this medicine as you think that this painkiller will make some harm to your baby as you are going to feed him, right? So yes, okay. Clarify further. You'll say yes, okay. Now then, empathization is the very, very important step when you ask the first concern initially. Then after empathizing, the next step is take a permission to ask more questions, ask questions. Then after asking the question, you need to repeat the answers and verify the statements with the patient. After verifying, thanks the patient for sharing the information. And then the next step would be when you'll say, thank you so much for sharing the information. Then try to relate that, as you have to convince the patient. Then say that this is because this could be one, never say directly that, this condition is because of your smoking. Never say that directly. Well, I have gone through your case notes, and from your symptoms, I understand this. From your lifestyle, I understand that the smoking and drinking habits could be, or possibly be the one of the reason of your current condition. And then ask about, do you have any idea about healthy lifestyle? So no, okay. Then start explaining firstly, secondly, and finally. This is very simple steps which we follow. If you keep in mind to follow these things, and that's gonna give you more and more score. Now, don't feel that, oh, empathization comes in the starting. So I'll say in the starting only. No, let's say at the end, patient said, one of my friend's mother died recently, so I'm so sorry to know about your friend's mother. So I understand how you must be feeling, but don't worry. We are gonna take care of you. You're safe and give emotional support. Empathization is very, very important. Is that clear to everyone?
Yes, ma'am.
Any questions about anything in the speaking? As I said, inpatient, you have mainly 3 or 4 settings. Now, this is inpatient starting. For outpatient starting, if it is a clinic, never say that what brings you here, even it is an emergency, never say how can I help you? What is the best way? That's why I always say that when you do a listening, always note down that how they start it, because your listening part A is always OPD. So how they start, like community health center, even clinics, community health center, all this comes under OPD setting. So you can start like, good morning, my name is Justine. I'm the nurse in this clinic. How can I address you? So my name is Tina. Oh, Tina, I have your case notes with me, but it would be good if you can say but in listenings you will notice they mainly use a very good phrase. They always say, perhaps it's a good idea if you will explain it in your own words. If you can explain about your condition, if you can explain about your symptoms in your own words, then she'll tell, okay, so all these things she'll say, then empathize. So I'm sorry to hear that you're not feeling well. But yeah, so don't worry. You're at the right place, and I'm going to take care of you. So don't worry. Empathize, and then start further. Now, this is the perfect OPD setting, community health setting, anyway, the clinic settings in this way. Now, third setting is important, is an emergency. Now, emergency, let's say the mother has brought this kid who is crying and it is a pediatric emergency, and you're asking, what happened to your child? Let's say the case is burn case. You think the child will be just sitting silently and you cannot see and you cannot find out what happened to the child? It doesn't happen in a real scenario. So you need to imagine when you read the task and it is written burn, patient is a burn injury, skull with hot water skull, or this is, yeah, you can say, oh, what happened? I can see that he got a burn. Well, how it happened? Let's say he's crying. Oh, your child is crying. What happened to him? Let's say the patient, old patient, she has a fracture. Oh, I can see that you're limping. What happened? You're not able to walk properly. What happened to you? Until unless something is not visible, it's written the patient has diarrhea. You can say that even it's a diarrhea, you can say, what happened? You're looking too weak. Right? Is that clear? Now, this is about emergency setting, and the last one is the home visit. And this setting, the best way to, always tell the reason the other person that why you are at his home. If somebody is coming at my home, I want to know that why you are here. Who sent to you? Why? So all these answers you need to give before. So for example, you can start, good morning, my name is Jasleen. I'm the nurse in your area's community health center. And your GP advised me to visit you in order to teach you about insulin administration. Is that okay with you? Or you can say, is that right time? Can we talk about that? Always take a permission. Is it the right time? Can we talk about that? Say yes. Okay, thank you so much for giving the permission. Well, as I said, your GP has sent me, he has commenced you on insulin. And so as a part of that, I'm here to teach you how to take insulin. I hope it's okay with you. They'll say, no, I don't want to take insulin. My sugar is perfect. Say, yeah, well, I understand. But your recent report shows that your sugar levels are quite high, and your current medications are not able to control that. And that's the reason your GP commends you on insulin. Then he'll say, okay, well, before I go further, so I just want to know that do you have any idea about insulin? So no, okay. So let me explain you that why it is so important to take insulin. Then talk about insulin, that why it is important, that it is one of the important artificial, important hormone which is produced by the body. But sometime due to some problem or some disorder, it is not treated fully, and then we have to give from outside in injection form. And its main job is to control the body sugar. Otherwise, it can damage. If the sugar remains high, it can damage the important and vital organs. So always go logically, like in a natural way. I think we should not afraid, because you guys all are professional, you all are nurses. It's not a new to you. You are always talking to the patient on a daily basis, explaining. So it is just you need to understand that how to start and how to speak. That's it. Rest knowledge you have. And good thing is that OET is not going to judge your clinical skills. They are not going to see that you have a nursing knowledge or not. If you're saying something wrong, let's say patient asks you about a side effect of a particular medicine, and he asks you about the exercise, and you don't know, and you're saying, I'll call the physiotherapist, he'll call you. That's fine. They're not going to cut your marks for that. But you have to speak, because they are gonna check your English only, not your knowledge. So if you will not speak, they cannot give you score. Remember that. So you have to speak. Never ever get nervous. Never stop in between, because that's one where you're gonna lose marks. If you think you're not getting a sentence, change that sentence immediately and say something easy. Don't go for a complex sentences. Don't go for a big sentences which you forget in between. Always use short sentences. Always use. Talk a simple language. I would strongly advise you to follow the healthy lifestyle. That's it, simple. Never make it a complex. I strongly advise you to follow healthy lifestyle, such as this and this, you go for a walk, you do this. Never make such a long sentence. Make a short sentence, put a full stop, and then move to the next. I hope it is clear to everyone.
Yes, ma'am.
Yes, ma'am.
Okay, I think it's gone more than 1 hour. I'm speaking continuously. So I would like to, now you guys, I want you to speak now. So ask me some questions. So there are always two things. If after the class the students are silent, either question is gone over the head, or it is inside the head. So tell me, it is over or in? It is in or outside of the mind?
In my
Inside the
mind.
mind.
Very good. Good to know that. So that I will see in a Tuesday session that how much you gonna implement this criteria in your speaking. Okay. So remember, when we take a handover, we always check the checklist, and then we say, now, yes, I've taken a handover. The same way the examiner is gonna have this checklist. He's going to check each and every line that you have used and gonna give you score. Clear?
Yes.
If you have any question, if not mind now, it is perfectly fine. If you have any question at any time, please share in the group. And please respond to others' questions. I've seen that a few days back, Nibha or somebody, no, Rekha, I think she shared a reading question in the group, and she asked everybody's opinion on that, and nobody answered. You know, if you will practice reading like this, if you, for example, while doing the reading, you don't understand that why this is the answer, you must take a picture of the paragraph and picture of the question and send to the group and let everybody answer and understand. you will never forget that once you will understand like this. Okay? So I would like to see more questions, Lissy, from you since you have an exam next month. So now you have almost a month still in hand. So please get ready yourself.
Yes, ma'am.
Okay. And I would like to see more queries from your side also, because when you study, you have more questions.
Okay, ma'am.
All right.
Okay.
Any questions from anyone? And post your answers by today evening of the warm-up questions.
Sure.
So, Liji, your exam is on 20th April or 20th March?
24th April.
24th April. Ah, a lot of time. Anybody has exam in March? No? Okay, so we have a lot of time. So practice well and see you all on Tuesday.
Okay, ma'am.
Okay? So you can ask me any questions. So if you have that in mind, so anytime you can just share in the group. You can text me. You can send your voice message. So anything.
Sure.
Okay. Have a good day. Enjoy your Sunday.
Thank you, ma'am.
Take care. Bye bye.
Thank you, ma'am.